It's Talk to Kedi, sharing knowledge, liberating minds. Hello there, thank you so much for joining us on another edition of your number one educational online broadcast, Talk to Kedi. Our topic of today is fungal skin infections. In other words, we'll be talking exhaustively about what fungal skin infections are, their causes, symptoms, types, people who are susceptible to these infections, the prevention and the effective treatment. My name is Felix Adedoyin. Welcome on board and get ready to learn. To do justice to today's topic is a registered nurse with over a decade of experience. She also specializes in entrepreneurial healthcare. She is an astute educator, a seasoned healthcare practitioner, and of course, a resourceful KEDI distributor. Please join me in giving a warm welcome to Dr. OMOLARA TOPE FANIYI. Doctor, you're welcome. You're welcome to Talk to Kedi. Could you do us the honor of introducing yourself to our viewers?
Well, good morning, everybody. My name is Mrs. Fanny Tope Omolara. I'm a practicing nurse, a healthcare practitioner, and of course, a KEDI distributor.
Okay, thank you so much for coming today, Ma. We are so delighted to have you on the show once again. If you're tuning in for the first time, this is Talk to Kedi, your number one educative online broadcast brought to you by KEDI Healthcare Industries Nigeria Limited. We are the leading provider of quality healthcare products and services nationwide. Welcome on board and stay tuned. Today, we'll be shedding light on fungal skin infections, a widespread condition that affects people of all age. And like I said in my introduction, today we'll be exploring the causes, symptoms, treatment options, and practical prevention tips of fungal skin infections. Sit tight and go on this intellectual journey with us. Fungal skin infection affect approximately 1 billion people annually, impacting around 20 to 50% of global population at any given time. Also, between 1990 and 2021, newly reported cases sharply grew from 1.03 billion to 1.73 billion, a staggering 67% increase. Alongside this rise, it was also discovered that overall prevalence and year lived by people with disability have also increased significantly due to these infections. Also, these infections are most common in tropical and subtropical regions, particularly in sub-Saharan Africa and also in South Asia. Countries like Nigeria, Ethiopia, Mali that have reported several cases of this infection among highest age standardized rates, underscoring the urgent need for awareness, prevention, and also accessible treatment strategy in this high burden area. Don't forget, you can be part of the conversation in the comment section. Let us engage. Let's rub minds together. Let's share insights. Share this link with everybody that you know. Invite them to join us in this intellectual journey of learning about fungal skin infection. If you have any question whatsoever, now is the perfect time for you to drop in your questions. Do not wait till the end of the broadcast. Drop it now. Please leave them in the comment section. And I can assure you that before the end of this broadcast, we will do justice to everything. Thank you once again. So, Doctor, are you ready?
Yes.
All right. That will take me to my first question, ma. I'd like to ask you, in your clinical experience, ma, how would you define fungal skin infections? And how do they differ from bacteria and viral infections?
Thank you. What is fungal skin infection. Fungal skin infection is an infection that strives on the skin caused by fungal. It is caused by dermatophytes. We can also call it yeast or mold. This yeast that we're using to bake bread is also a fungal.
Exactly.
So it's quite different from fungal. Is quite different from virus and bacteria. Now the question, they are different groups, as in fungal, bacteria, and virus. Now, if you want to see the let me now explain the fungal, virus, and bacteria. Bacteria infection is caused by bacteria. The bacterial skin infection is always acute, as in is rapid development, and it has these symptoms of skin rashes, inflamed redness, pain, and pus formation. That's the then for the viral skin infection, for that one it used to give symptoms of like blisters, and it gives some rashes too. But it is self-limiting. It by itself it can go. That is the viral skin infection. But now for fungal skin infection, that one is chronic, is gradual. It will start and it will be going like that. Then the symptoms include itchy, scaling, peeling. It's always like that. And is chronic. I mean chronic when I say it takes a long time, and without treatment it won't go.
All right. So why are they so common in tropical area like Nigeria?
You know, like in this environment, apart from poor ventilation, then the way people live, you know, direct contact with somebody that is already infected. So let me just say the cause is because we're in the tropic.
Yes. And Nigeria is located in the tropical region. So that's why it is common in this area.
That's why you see it's common in this environment.
That takes me to my second question, ma'am. You earlier talked about the different types of fungal skin infections. So I want you to tell us, ma'am, what are the most common type precisely? You know, you talk about the three types. What are the most common type, and also buttress it by telling us who is most at risk at each of these types.
When we talk about the types, the one I said the other time is the group as in bacterial, viral. Now we are not talking about the type of fungal
skin infections.
Mainly, it is called tinea and candidiasis. Now, tinea is named according to the part of the body that is affected, that is infected. For instance, tinea corporis is the one that affects the body, the skin. The ringworm that people knows and is common among children. Then tinea capricis is on the head, Both tinea corporis and tinea capricis affect children below age 5 years down.
Those are the ones affected. Those are the group infected.
That's the group that is infected. Because you only see it in adults. It's among the children that are going to school, in kindergarten, they play rough play, they share it among themselves. So it hardly affects adults. Now the next one is tinea pedis. This affects the feet, the fingers and the feet. This is common among the gym people that go to gym, people that share socks, they share undies, they share, they are dirty, they don't wash their clothes in a way. And apart from somebody that is dirty too, anywhere they are sharing, it affects them. In the
anytime you're sharing,
towels, comb, clothing material, you know, somebody wears today, another person wears the other day. Then let me look at it. I want to say everywhere they share, like hotels, gym, then let's say prison. So you know, in such a place that is crowded, and people they get infected. Then another one is jokish. That one affects those people that are obese. It affects the groin, and there's an aspect that is the one that affects under breast of ladies. Armpit is still a type 2. The other one is candidiasis. Candidiasis affects children who, because of their using pampers, because of wetness, the darkness in that place, the mother do not know they've urinated, they've peed. By the time they remove it, it's hair. And people that are immunocompromised, diabetic patients, and people that are immunosuppressed, they can be a victim of that.
Oh, wow. All right, so with all this, we've learned about the groups of fungal, group of fungal infections and co. We also learned about the types precisely of fungal skin infections. You've talked about the Candida and the Tinea and Tinea HSPP. All right, so what are the main causes and symptoms? I know you've talked about it stylishly, but I want you to go in depth on it. What are the main causes and symptoms of these fungal skin infections? Let's start from that.
Okay, let's look at the causes. The main causes, let's look at number 1, which is our environment, because that one cannot be overlooked. Now, where the tropical climate, number 1. Number 2 is the act of sharing, and you share, people that decide to be sharing things together. The main causes is contact. Whether direct contact with somebody that is infected, you touch the person, you mingle with the person in a way the person can get.
So it's somehow communicable?
Yes, it's a communicable disease now. It is communicable. That's why we say in sharing, people that shares clothing materials, somebody wear trousers today, another person wear it tomorrow, all these, the napkin, towels, and all those things. So is communicable. So that's one of the ways that somebody, and like I talk about poor ventilation too. The way our we are in we are densely populated, and we in one way or the other, you see that we are living in an overcrowded area.
Especially in this Lagos.
Especially in Lagos, especially in certain environments in Lagos. I also want to be saying, you see that where you see people living in face may face you, and where you see people, about 6 people living in the same room, the same bed, and so there's no way. That's why it's like that. It's one of the way that. Then the next question is
No, I just wanted you to be able to show us precisely the symptoms of all these things.
The symptoms is itching. Scaly rashes. Let me talk about athlete's foot. When I was talking about athlete's foot,
yes.
The athlete's foot, there's a way it makes let me use this language, makes fingers to be ugly, damp, dirty, and some ladies cannot even show off their fingers. And the same thing happens to the leg. There is cracking in the leg. There is
like those ones that have cracks at the back of their legs.
Yes, that have cracks. And peeling in their legs. They call it cracks and peel. Then you see itching, sometimes pain when it is inflamed, and because when the secondary infection, which is bacterial infection now, because of the fungal infection, there will be weakening of the skin. Then because of the weakening of the skin, secondary infection, which is bacterial infection, will come up again, and everything will not be there. And the thing, like I said, it doesn't go except it is treated.
Okay. So I like to ask, this one is off the script now. What about, I've seen some people that underneath their toe, or in between their toe, there are this kind of dampness look. Is it also part of this fungal skin infection, or is it bacterial or viral in nature? I don't know whether you know what I'm talking about now.
Yes.
You see in between the toes or underneath the toe, as if there is a whitish.
Is still this fungal? Yes, that whitish coverage is a fungal infection. It's fungal infection, and it is there. It's very common among footballers that wear shoes. I want people that wear shoes, because once you wear shoe, the thing like squeeze the leg, then you wear socks and you sweat in the fungi will strive very well in that environment.
It thrives in kind of a moist environment.
Moist, warm environment. Warm environment.
All right, that takes me to my next question. That's my question number 4. What would you say, or would you say poor quality soap contributes to skin irritation or infections?
Yes. Poor quality soap will definitely contribute to it.
Okay.
Because soap that is too harsh for the skin will remove the normal oily protective brand that is supposed to be on the skin.
Okay.
It will remove it, and once it is removed, this one will make the skin to be susceptible to infections.
Okay.
So poor quality soap will make skin to be susceptible to infection. So definitely yes.
It is a yes. So what are the biggest misconceptions people have towards fungal skin infection? Do you have anyone?
Yes.
Okay.
I think I have two. Number one, people think that people that have fungal infections are because they are dirty. No, really that. It is because of our environment and because of the warmness, or because of the moist, sweaty, especially people that are obese, that they have to sweat over and over. So they can be neat, they can still develop. That's one misconception. Another misconception is that they believe that antibiotics can take care of it. Antibiotics may even aggravate the problem, except it is treated with antifungal.
Okay. So we can use antibiotics. You have to use antifungal things. Okay. All right. So that takes me to my next question, Ma. In case of a mild fungal infections, like ringworm and the athletic foods that I've talked about, how effective are antibacterial soap, such as KEDI Nano Silver antibacterial soap, in managing this condition? And what preventive measures can people take to avoid contracting or spreading fungal infections, practically in this our region like Nigeria?
Yes, the first question is that our KEDI Silver Nano antibacterial will do a lot to help in protecting the client. Then it will take care, it will go a long way in managing it. Now let's now go to how do we prevent spreading it. One of it to prevent spreading it is that we should maintain our cleanliness. Because they say cleanliness is next to godliness. So you have to maintain your cleanliness. Stop sharing things. Stop sharing towel and maintain good ventilation where they live. And once they contact this fungal infection, they should take care of it as soon as possible, so that they will not continue to share it and be spreading it to other people. So these are the things I think.
Okay, that is the way. Those are the preventive measures.
They should avoid dampness and keep themselves clean and dry.
Okay, let's now look like the scenarios you've painted for us. In a house whereby the father, mother, and like 4 kids are maintaining just a singular room, how can you do with that? Like you said, some regions, we are using Lagos as a case study now. Some regions in Lagos whereby many persons are managing just a singular room, and it is normal that this widespread of fungal skin infections can be possible. So how can they manage such a scenario? There is no way we can ask them to leave the house or to go and look for other accommodation. So how can they manage such place?
I think if I will say, when you believe something is not normal, you look at the way out. We all know that it's not normal. That's it. So they should look at how to make sure, apart from, for now, maybe like you said, they can't just say they should go away.
Yes, they can't leave the house.
They should maintain their cleanliness. They should maintain dryness. Maybe everybody should have their own towels, and make sure they wash their clothing, and they should not share clothing materials. But you got up them, that place is not ideal.
Okay, please, let me still take you down this lane too. You are telling us that they should not share any item. I've seen houses whereby there's just one bathing soap in the house. So, can sharing of that bathing soap also leads to transfer?
Yes, sharing of bathing soap can lead to the transfer of fungal infection.
So, are you now saying that each person, each child, father, mother, kids, they should have their individual soap to avoid sharing?
Yes.
That's the best.
That's the best. That's the best. The best does not really actually mean that's the best. That's the way out.
Okay.
That's the way out. For instance, if you see people is from the prison, anybody that just came from the prison, you pity them.
Okay.
Because of, even without anybody telling you, you will see this fungal infection all over them.
All those rashes.
All those rashes and everything. And just because they are in an enclosed environment where they keep sharing it. The same thing happens for 6 people to be in a room. I think the way out is that they must just do the right thing. Everybody should have their, maybe they will buy our soap. And cut it to two.
Wow. All right. Okay. So now that takes me to my next question. It says, can untreated fungal infection lead to complications or spread to others? Let's start from there.
Yes. Untreated fungal infection. You know, this fungal infection, I've seen people treating it, they've been managing it, they see it as a very difficult disease. Okay. Because they would have used a lot of things and there will be no solution. Because I told you it's a chronic disease, it's a chronic infection. So, and if it left untreated, it will be spreading. It will be spreading and it may lead to complications that may even be systemic, that may enter their body.
Can you give us an example of those systemic things that can
when if there is anything like a septicemia, that is an infection of the blood, when if it is too much, the person will know too that there is problem. So if there is skin infection that is too much, it can cause septicemia. Then before septicemia, it will cause a secondary infection that I call bacterial infection. That is when you now see pustules, pus formation, pus coming out of the body. It's because it's spreading and it is not stopped. So that could be, so it has to be stopped.
So how serious can it be if it is neglected? How serious, how severe can it be if this sickness, this infection is left untreated?
If it is left untreated, like I say, it will lead to secondary infection, which is bacterial infection. It will lead to septicemia, it will lead to loss, anemia, it will lead to a lot of sicknesses. So it's not good, it has to be stopped.
So what advice, what practical advice would you give to people on choosing the right skin care routine to protect against fungal infections?
Thank you very much. You know, like we said, some people, they don't bath regularly. It's good to bath regularly and bath with a good mild soap like this, our Needle Silver antibacterial. It's good to be bathing with, especially in this Lagos that we meet ourselves. For instance, in Lagos, there are certain parts of Lagos like Oshodi. Except you are inside your vehicle, you are going on the road, there is no way you will not match a lot of dirtiness, especially this time that is raining. You know, we have a lot of rain in Lagos, and the streets, you know the way it will be. Once you go out, you come back, you have to wash with a very good soap. So to maintain a good hygiene, bathing regularly, better morning and evening with soap. Then I said stop sharing things that is not that will make you to contact it, or when you contact, take care of it as soon as possible.
So the only practical tip they are sharing for us today is that we should only make use of like bathing regularly. No other thing can be a mode of advice, practical advice that can help avert the occurrence of this fungal skin infection.
Like, let me say something. There's no way, like I said, one of the best way to contact this thing is contact, whether direct contact with somebody that is already infected or somebody that you just come in contact with that person. And let me tell you this truth: the basic fact is that there's no way you can avoid that in Lagos. You must, whether you enter public transport, you sit with somebody, you know the characters you can sit with inside the vehicles. So now, when you get to avert all these problems, it must be, you must go and freshen up. That is it.
All right. Before we check through our comment section for questions, I like you, Ma, to tell us. You know, you've been talking about our silver soap, nano silver antibacterial soap. Can you let us just dive in a bit?
Okay.
Can you tell us more about this particular soap so that our viewers can get to know this soap that we're even talking about?
So we are talking about our Kedi Nano Silver antibacterial.
Nano silver. We have it. Let me show you. Let's show them this soap.
This is the Fungal soap
Yes.
that we are talking about. This is an antibacterial soap.
Yes.
Like I said, you want to protect yourself. You don't want to be a victim of this chronic fungal infection. You have to maintain cleanliness and bathe regularly. Morning, if possible, twice a day. Especially when you know that you have mingled, you have come in contact with people. Especially when you see that you've mingled with somebody that have it, or even not. To maintain and protect yourself, take this house soap.
What about the sulfur anti-acne soap?
Yes.
Do you have what we can do about this one?
This sulfur anti-acne soap, you know, we're talking about acne. A lot of people, especially people that suffer a lot about with this acne, many of them have tried many things. It will even be as if they are dirty, and it's not because they are dirty, but it's because they have not used the right soap. So if they use this our anti-acne soap, you will see the difference.
Okay. I can see we have another one. This is the pearl whitening soap too, ma. How about this one? What advice will you tell our people about this particular soap?
These are pearl whitening soap.
What does it do? What does it do? Who are to use this type of soap?
I think those people that want to maintain, they want to maintain their beauty. They want their normal growth to come out. Yes, they are the one that will use this one. All
right, we've heard it from our nurse, that's Dr. Faniyyi OMOLARA. She has explained to us about these three soaps as we have it here. The Nano Silver antibacterial soap, which is very essential to help guide against any form of antibacterial infection on the skin that you want to dabble into while you are mingling with a lot of persons. If you want to, let me read what he said. He said it is formulated with nano silver to eliminate harmful bacteria from to eliminate harmful bacteria from your skin and to give you a clean and healthy skin. As I have it here, someone like anyone who wants to get rid of antibacterial contacts, as our nurse has rightly said, go make use of this particular one. And also for the sulfur anti-acne soap, just like she rightly said, if you are having oily skin, you are always prone to having acne on your body. When you make use of this particular soap, then it actually works the magic. And for someone also who wants to maintain their skin, you want it to be glowing at all time, the pearl whitening soap is your best bet. So with all these three soaps, I can bet it with you that your skin will be glowing and radiating at all time.
I want to add something.
All right, ma'am.
For a reason, whether for any reason, anybody sustain an injury, a sort of cut, while doing anything, the person can quickly wash with this
nano silver
antibacterial.
Okay.
Yes, wash with it. It's an antibacterial, nothing like tetanus, nothing like inflammation, anything like that cannot happen. Once you wash immediately with it.
All right, we've heard it all from our amiable Dr. OMOLARA TOPE FANIYI, and she has exhaustively explained to us fungal skin infections. We learned about the group of skin infections that we have. We have the fungal, we have the viral, and we have the bacterial skin infection. And she moved further to explain to us the types of fungal skin infections. We learned about the causes. We have the candida one, we have the tinea, types of fungal skin infection. Indeed, she has done a lot about this topic. So, ma, I would like you to read for us our Dr. Cap health tip for today. Could you do us the honor to read it, please?
Thank you very much. Dr. Cap says, protect your skin from fungal infection by keeping it clean and dry. Regular use of Kedi sulfur, anti-acne, hair whitening, and needle silver antibacterial soap helps to clean, protect, and guarantee you a healthy skin.
You've heard it again. She says that a regular use of all the 3 beauty soaps that we have here will help to give you a good skin. It protects, it's going to cleanse, and also guarantee you a healthy skin. With that, it is a wrap on this edition of Talk to Kedi. I hope you have learned something valuable today about fungal skin infection. Special thanks to our amiable guest, our wonderful guest, for taking time to share with us from our wealth of knowledge. In case you joined this broadcast late, don't worry. The full video will be available on our Facebook page at Kedi Healthcare Industries. It will also be on our Instagram handle at Kedi Healthcare _official. Also, you can check our YouTube channel at Kedi Healthcare, and also our mobile application at that's Kedi Care app. Feel free to watch and share with all your loved ones. Don't forget to join us and for the next edition of Talk to Kedi. It promises to be insightful. Thank you so much for tuning in. Till I come your way next time. Bye for now.